over the last 24 hours, we did 140 tests, and of those 140, we diagnosed 2 persons. So currently we have 102 persons with active COVID, and we also have 10 persons right now in the Ocean View Hospital, with 4 of those persons in the ICU. So over the last week, we have seen an increase in cases, gradual, but there is an increase in cases. And we have also seen an increase in hospitalization. So let's take, if we compare October with this month, November. In October, we probably had our best month for the year. We had 0 COVID deaths, and we had 87 cases overall for the month of October. In November this year, we already have 3 deaths, and we have 107 cases so far. So there seemed to be an upward tick in terms of cases and in terms of people requiring hospitalization. So we have put all of our doctors, medical personnel, again on alert. The systems at the Ocean View Hospital is fully deployed. So really sick patients would go there. And all the units that we have across the country in different regional hospitals, they are available if people get really sick. So in terms of vaccination, we haven't seen a lot of people coming forward to be vaccinated. So let's take over the last 24 hours, we've had 63 vaccines being administered, and that's with all the vaccination centers that we have. At this point in time, we are really encouraging people, if you've had your vaccines more than 6 months ago or 4 months ago, it is time for you to come back to get either your booster shots or to continue your vaccination. When we started giving vaccines, you had primary doses, first and second dose. And what we quickly discovered is that 6 months after your last dose, between 4 to 6 months after your last dose, your immunity would drop. So to keep you immunized, then the idea is to make sure that you have your booster shots. But not a lot of people in Guyana has been coming to get their boosters, and that has been a problem for us. So as of today, we've had 76,131 persons who would have received their first booster doses. And in terms of the second booster dose, we would have administered 4,276. So we are giving booster doses, and we really encourage people to come and get them. So we have started with the first one. There are people who are eligible for a second one. We have started administering that. And so we just want people to come and make sure that they're immunized. More so, that if we're seeing cases going up, then it is important that you stay protected. And the only way you can stay protected is to make sure you get these booster doses. Again, the people who would be more vulnerable are those persons who are older. So if you fall into that category, you should make sure that you come and get your booster dose. Persons who have other illnesses like diabetes or high blood pressure or heart disease and so forth, again, these persons are more at risk, and therefore they should ensure that they get their booster dose. Other persons who can be vulnerable are persons who are immunocompromised. They are diseases that would make your immune system not work properly. So people, for example, who are diagnosed with HIV, these are persons who would want to come in to make sure that they get their booster doses. So there are a number of reasons why specific groups of people ought to be boosted, but this does not prevent the general population to also come for booster doses. I'm just singling out a few specific population groups that really, if they get the booster doses, it would protect them. So the 3 deaths that we've had over the last week, we have certainly sent those samples. We have made arrangements to send them to be sequenced, and that's because we want to understand whether or not which variant is circulating here and whether it's the same types of variants that are causing death among our patients. So this is something that we would do routinely to get an idea of what is circulating and what we need to look out for.